Lakeland Currents, your public affairs program for north central Minnesota. Production funding for Lakeland Currents is made possible by Bemidji Regional Airport, serving the region with daily flights to Minneapolis-St. Paul International Airport. More information available at bemidjiairport.org. Closed captioning for Lakeland Currents is sponsored by Nisswa Tax Service, tax preparation for businesses and individuals. Online at nisswatax.com.
Hello again, I'm Jason Edens, your host of Lakeland Currents. Thanks for joining the conversation today, and thanks for your ongoing support of Lakeland Public TV. Friends, the COVID-19 pandemic has upended life for all of us. Very few people have been spared. However, the impact of the pandemic has not been felt equally by all communities. In fact, the health and economic impacts have disproportionately affected lower income communities and communities of color across the continent. Here to help us understand the unique challenges and responses within the Leech Lake Band of Ojibwe are its chairman, Farron Jackson Sr., and medical officer on the Leech Lake Incident Response Team, Terry O'Connor. Gentlemen, it's an honor to have you on the program, and I really appreciate you taking time out of your busy schedules today.
Thank you.
So I understand the council recently decided to extend the stay-at-home order until June 1. Mr. Chairman, can you give us just a general sense of how the community is affected by the pandemic and also how you're adapting?
Okay, Jason, thank you once again for allowing us to have this time here. But we on Leech Lake, we're taking this pandemic very serious, and rightly so. It's a very serious issue here, and we're treating it as so. We have a high number of elders that reside on Leech Lake here, and we honor them. We hold them high in our honor system here, as well as our rest of our membership as well. We currently have, I believe it's like 1 out of 5 of our members are elders, today, compared to 1 in 10 back in 2010. So we always kind of keep that in mind when we think about what's happening in the world. So we know we have health disparities here, and our team, our incident command team, has been working very diligently of what's happening, and I'll let Mr. O'Connor speak to that in a minute. But as far as the tribal council, we always practice safeguard measures in our decisions, and the stay-at-home order was extended to June 1st, to monitor and track our data here on Leech Lake, with our recent fishing opener and our big Memorial Day weekend we had. So we want to be cognizant of what might happen, where we have our medical team up here, our health director and our incident command center team kind of briefing council on as numbers change. So we want to make sure that we're doing our part here on Leech Lake to contain the spread. We know it's here. We're aware of that, and some of our outlying adjacent counties have higher numbers than Cass County. So we want to look at it in things that we're doing good. We're practicing our social distancing here. We're practicing using face mask and hand sanitizer, and we're doing our part to minimize the spread. So, and we believe that it is working. It's making an impact here. So we want to continue on that process. And that was one of the main reasons the council did extend the stay-at-home order until June 1st.
Mr. O'Connor, I have a question for you about the incident response team. I'm interested if you can tell us a little bit more about the role of the incident response team. And some would argue that parts of the nation were caught flat-footed when the pandemic first emerged. How rapidly did Leech Lake respond, and how did you respond?
It was, we had several meetings prior to this from our health emergency response team, our TURC, our Tribal Emergency Response Committee, within our division directors, tribal council meetings. We knew it was coming, and we discussed ways to respond to that. So it was like 2 days after Chairman Jackson declared a health emergency for the Leech Lake Band of Ojibwe. we stood up, we activated our emergency response center, and we stood up a type 3 incident management team using division directors and department heads to fill in those spots. And we went into action right away, how to best protect our treasure, which is our elders, our future, which are our kids, and everyone, not just essential employees, but we see all our people as essential, because might not be great in numbers, but any death would affect us. So we did what we could with what we had. And we meet daily. We have a daily briefing. We we search high and low for PPE, sanitizers, wipes, anything that could best protect us.
Well, there's a lot of talk about how the peak has already arrived in some parts of the country, but it's highly unlikely that rural America and rural Minnesota will have a peak for many months yet. So, will the stay at home order be extended beyond June 1, or what are your strategies going forward?
Okay, I can take that back. Good question, Jason. Yeah, that's all going to depend on what happens from day to day. We're looking at this situation day to day, week by week, and so we kind of monitor, like I said earlier, monitor our numbers daily, and we got to see where we're at here. As I know June 1st is around the corner, but a lot of things can happen on a day to day basis, and whether or not the council decides to extend the stay-at-home order past June 1st will determine the numbers, or how our numbers are at that time. So we get a lot of our information from our incident command team members, and that they factor into our decisions. So we utilize they what they've been doing. They've been working very diligently on keeping us updated with up-to-date information. So that determination will be made shortly before June 1st.
Understood. Well, the tourist season this year is a bit of a double-edged sword. I'm wondering if Leech Lake has a position regarding welcoming the many people to the beautiful lakes of northern Minnesota this year.
Well, we've been very excited about our tourists. I know they enjoy Leech Lake like we do, but at the same time, we want to express caution. We get a little leery when we have tourists coming from the cities and tourists coming from out of state, and we've seen a lot of different out of state license plates up here, and in places where we shop, where we frequent, we see a lot of the tourists not wearing protective masks, or not practicing social distancing here, and so that is a concern. It makes us very wary and cautious of what kind of impact that could have on our numbers here as days go by and weeks go by as well. So we've been a little leery about that too. I mean, we don't have, we're not like a closed reservation like Red Lake, where we could close our borders here during this challenging time. But so that's where we stand on that.
Mm-hmm. Well, I'd like to talk a little bit about employment. I believe as of this morning, 1 in 4 workers across the country are currently out of work. With Leech Lake Gaming employing such a big chunk of the population, I'm curious, how are families getting by? Will those folks get back to work soon, or what concerns do you have about employment right now?
Well, that's our goal here. I'm sorry, I'm gonna have to take this off a little bit here. So yeah, we have concerns about that too. I know our employment here is very important to all the members, and non-natives as well. We're the largest employer here in Cass County, and we're very proud of that. Our intentions are getting all our employees back to work. We want to get them back to work here in a safe way. As long as we have precautions in place, we want to do it in phases and bring all the employees back, in a safe way, So that's the way we're looking at this right now. And so, that's our goal. That's our goal is to do that, is to bring the employees back. But right now, a lot of them are surviving on unemployment compensation, and that $600 supplement unemployment benefits really help. So we're kind of we're monitoring that day to day.
So health and safety first and foremost, and most of the families are in fact receiving unemployment insurance.
Right. Yeah. Exactly. We're waiving. The tribe is picking up the health and dental benefits for our furloughed employees right now, and we're going to extend that through June. So, like I said, it's going to be a week by week discussion that the council is going to be engaged in.
Well, just one more follow-up question on that same topic. The band recently opened up Cedar Lakes, a new casino and convention center. Are you concerned at all about its future and the associated jobs?
Yes, we are. We are concerned about it. We were just kind of in our early stages of utilizing our new gaming establishment, and it was doing very well. And along comes this
Mhm.
COVID-19 pandemic, so it kind of it was never good for the timing for the COVID to come here in the United States and on Leech Lake as well. But we're set to deal with it, and we're looking forward to when we can resume our operations here at our beautiful new Cedar Lakes. And so yeah, we're looking at it optimistically, and hopefully we're going to rebound from this. I know it's going to take some time, but we're optimistic that it's going to resume and kind of start back out. We're not right from the get go, but we can get resumed to be a good business establishment.
Sure. Well, I'm happy to hear that. I want to talk a little bit about the disparity in terms of how communities can respond to a stay-at-home order. Of course, there's been a lot of talk about working remotely or working from home, but of course, not everyone can do that. If you work in retail or in service, it's difficult. And if you don't have access to broadband, it certainly is more difficult as well. So I'm curious, is e-commuting helping members of the Leech Lake community?
Okay, yeah, that is a good question, Jason. We have some employees that are able to work from home, and there are some that can't. We have emergency workers that are still working today. And so in some of our outlying areas, yeah, we're kind of a lot of broadband is not accessible, unfortunately, in this day and age. I know it's hard to believe, but it's up here in Cass County. So we deal with that the best we can, and so we will continue to operate that way. But we have a very committed workforce, and we improvise. We do what we can to keep the essential programs and our services active. So that's how we've been kind of working through that dilemma.
Mr. Chairman, the Federal CARES Act, which of course was the federal response to the COVID-19 pandemic, allocated $8 billion for First Nations or Native nations across the country. Has Leech Lake seen those dollars yet?
Yes, we got our shit. We got appropriated a dollar amount with the CARES Act funding. So tribes were allocated. I believe they used formulas. As employees, population base. So yeah, we did receive a share of the funding.
And what will that be used for?
Well, that will be used for a lot of ongoing economic loss that we deal with here. I know there's stipulations on how that CARES Act dollars can be actually spent and utilized, and for we talk with our legal team about lost revenue, about health care benefits, about just a lot of different dialogue goes into on how we can utilize the dollars there, because we've never been in this dilemma before. So we want to make sure that we don't violate any of the funding agreements with the CARES Act dollars.
Thank you, sir. I appreciate that. Mr. O'Connor, I have a question for you about the health response. Of course, the federal government has a codified obligation to ensure the health and well-being of Native Americans, and the Indian Health Service is a big part of that. When the first peak occurs in rural Minnesota, do you have confidence that the IHS will have the capacity to meet the needs of your people?
I can't speak personally for IHS, but the Leech Lake Band is doing everything they can with what we have, what we can get our hands on as far as personal protective equipment. I identified right away that because a strategic national stockpile was not forthcoming with PPE, we ordered from overseas, and kind of a tiered response. We made sure our elders all had masks, couple masks to go on. And then when additional surgical masks arrived, then we made sure every resident within Leech Lake had at least 4 masks to go on. So I think to date, we distributed close to 58,000 masks. We also have large bulk items of hand sanitizers, wipes, uh, additional personal protective equipment. Uh, for when that peak or that surge does get here, you know, we're confident we have enough stuff in place to protect all our people as best we can.
I'm really surprised to hear that. So, just to be clear, the Leech Lake Band had to procure PPE and other critical supplies from overseas.
Correct.
And were you competing with other First Nations or potentially with other states? You were essentially procuring on the open market.
Procuring on the open market, we try to collaborate with other bands. Um, I don't know where it went with that, but we had to do what we had to do, and
Mm-hmm.
we went after it and we got it.
Well, I'm happy to hear that. If band members can't be treated locally, will they still receive the equitable care to which they're entitled?
Yes, and we follow a lot of the guidelines from Minnesota Department of Health. You know, we look at what's going on with the Center for Disease Control. I have to follow the Emergency Medical Services Regulatory Board guidelines for COVID-19. So all this stuff comes into play in how we respond.
So if someone who lives in Cass Lake, for example, needed to be transferred to a larger hospital, then they would continue to have access to the same quality of care that would be provided through your health infrastructure.
That's correct. All the hospitals in northern Minnesota, I think in the state actually, had developed COVID protocols. So if we have suspected case or confirmed case, we have to transport accordingly and notify them. You know, we take extra precautions and do what we normally do.
Well, I have a question for both of you. When the pandemic was peaking in New York City, for example, or in Boston, it was, of course, international news. However, again, parts of rural North America probably won't see the peak for months. Currently, the Navajo Nation has the highest rates of infection on a per capita basis. So, what challenges do you see for the Leech Lake Nation and its people over the next year as the focus and the geography of the virus change?
I think we really have to keep on top of it. Look at the trends. We look at the daily numbers from MDH. We disseminate the news. You know what's pertinent for us. How best we can respond. Do we need to purchase more stuff, more PPE, more medical supplies? We've identified places as alternate non-COVID sites. Got phone calls to National Guard for mass testing. We're doing everything we can with whatever's available out there. We
Well, I
just
was
have to
going to
keep on top of it.
Oh, I apologize. I'm sorry. I was going to ask you about testing. I'm curious, what's the testing capacity right now within the Leech Lake community? Are you working with the National Guard or are you independently testing?
We have independent testing. I think IHS has MDH testing. The band has purchased some Mayo testing, and then we have a request for National Guard testing, which is also going through MDH.
Do you have any estimate at this point what percentage of the population has been tested?
No numbers yet.
Hmm. And are you doing anything to support community members or band members who live off reservation?
Yes, we've made the PPE available to our Twin Cities office, Duluth office, and we set up a hotline for other outlying areas that are off reservation for specifically for elders, but we're kind of opening up surveys to see what the wishes are of our community members that live off site.
I'm wondering if you can help us understand a little bit about what the the day-to-day life is like currently for band members. What's changed? What's uniquely changed within the community? Can you tell us a little bit about how people are grappling with this on a day-to-day basis? Obviously, we're all suffering in some way, shape, or form, but I'm wondering if you can help paint us a picture.
More people are getting back to nature.
Hmm.
Yeah, see it, hear it.
Well, I can respond to that, Jason. I feel a lot of calls from our membership here daily on the weekends, and everybody is experiencing hardships here because being confined or contained to your home a large part of the day is something that's not normal. Our memberships, like a lot of people in Minnesota, at the time we're in right now, summertime, people like to travel about. They enjoy nature. So it's definitely an adjustment here. And everybody is taking this issue seriously. So a lot more members have been staying home. We have members that are staying home. Only traveling for the essential travel that they need, groceries, and maybe some medical appointments or things of that nature. But all in all, people are a little discontent, with what's happening. Maybe keeping we encourage them, to keep active, to keep exercise in your yard and do things close to home here till we weather this storm, and we don't. And I let them know that it's all, when you protect your family, you're protecting our families as well. So that's the approach we look at here, and our membership has been rising up to the challenge, and they have been making sacrifices as well, and we commend them. They don't like it, but they're doing what they have to do at this time.
Well, I was wondering if you could tell us a little bit about what school is going to look like in the future, whether it's at the Leech Lake Tribal College or the Bug School. Can you tell us a little bit about what the next school year will look like, or is it too early to tell?
I think that's a little premature to make a comment on that because we really don't know. I mean, it's hard to say if we're going to have to continue distance learning or online classes. We're not really sure right now, so we have a little window there to see where our numbers go. Hopefully by fall, maybe we'll have a better understanding of where we're at, and so there's a lot of variables that we have to look at.
Yes, sir. So that sounds like that's an ongoing conversation. Mr. O'Connor, you mentioned something that struck me as a bit of a silver lining. You said a lot of people are getting back to nature. And I know a lot of people have been having conversations about things that have emerged during the pandemic that have actually been some sort of a blessing in disguise, something unexpected. Can you share something with our viewers that has been unexpected, but yet a bit of a positive development?
Well, if you know the Anishinaabe people, the Ojibwe people, we might not be religious, but we sure are spiritual. And we have a love of the land, our elders, our teachings, our medicines, and that was the one of the first things that the incident management team did was gather one of our medicines, which is cedar and wild rice, and make sure all our elders had at least that right from the get go. And I think that was a calming effect because they seen we were doing something initially, and uh, and we hear from a lot of community members. They're looking at picking the medicines from the what the creator has given us out in the woods, and getting back to nature, and families are getting closer again. The
Mm.
lack of internet, lack of schooling, social distancing. A lot of families are getting back together again, and and rediscovering themselves. You
Mm.
know, we kind of got away from that, and we're seeing more of it now.
Well, thank you for that candor. I'm curious, are you collaborating with the other Native nations within Minnesota on the incident response? Are you sharing lessons learned, for example?
Exactly. Like just yesterday, I talked to Ed Stessinger over in White Earth Emergency Management. You know what they do and what we do is, hey, if this working for them, why don't we try this? You
Hmm.
know, what's working for us? This is what we're doing. You know, it's just sharing of knowledge.
Can you give us a quick example of something that you gleaned from another First Nation?
Uh, just that their math, you know, that was my phone call to White Earth was what's your mass dispensing plan? And it was a drive-through plan, so we're looking at that, how to adopt it for us.
Hmm. Well, I want to close with a question for you, Chairman Jackson. I really appreciate both of your time. And I also enjoyed reading your bio on the official Leech Lake website. And I believe at the bottom of the bio, you wrote, I believe when a person lives his or her life by their true inner feelings, their true self will come to surface. I'm curious, what guidance do you have for band members and non-band members alike who are struggling to find direction, struggling with the uncertainty during these challenging times?
Well, I'm glad you caught that. Yeah, that's a very powerful statement, you know, and it has a lot of meaning to it. And you know, when we look at this as an awakening, you know, as a renewing, you know, how important life really is, you know. Sometimes, through human nature, we have a tendency sometimes to take good health for granted, you know. But when it comes to these situations, when it looks like it's a life or death situation in our communities and it affects our loved ones, you know, it, it is an awakening, you know, to be appreciative of life, you know, and to look at the hardships that a lot of people have endured, you know. The native people, the indigenous people have dealt with hardships and dilemmas for their whole lifetime, you know, and just to make it so we could be here today. And it's kind of somewhat grounding us again, just kind of opening our eyes and looking at life and just what a gift it really is here. And not a not a time just to be frightened and scared, but just to acknowledge, you know, the gift that the Creator bestowed to us is life with our elders, with our children, and you know, and we also concerned about nature, you know, and like Terry was talking about how you know we feel at ease. It's like therapeutic when we go when we retreat back to the woods, you know, our forest, you know, or our grandfather trees are there with medicine, you know, and it's a calming effect, you know, and that's how we endure these hardships and alleviate some of our anxiety and stress, you know, and you feel good. You feel good when you know when you utilize what's here for us here on beautiful Leech Lake.
Mr. Chairman, I want to thank you so much for sharing that. And gentlemen, I want to thank you very much for joining the conversation today. I really appreciate it. And I wish you and your loved ones and everyone within the Leech Lake community the very best.
Thank you, Jason.
And thank all of you for joining me once again. I'm Jason Edens, your host of Lakeland Currents. Be kind and be well. We'll see you next time.